Hello everyone. My name is Dr. Shreyans Patil and I am a consultant psychiatrist working in Maharashtra and Kolhapur city. Today I'll tell you in brief about when you need to meet a psychiatrist and when is actually you need to take professional help. So, first, initially, what do psychiatrists do? Psychiatrists treat the mental illnesses and the behavioral illnesses. So, what are the mental illnesses here? Mental illnesses and behavioral illnesses, as we know them, the most common ones are depression, then we have anxiety problems, disorders, then we have different types of phobias, then we have other uncommon disorders like PTSD, and major mental illnesses like schizophrenia and bipolar disorder. According to WHO, the total prevalence of psychiatric problems in all over the world is around 14 to 16%, depending on the nation. Psychiatric disorders do not differentiate between any of the race, culture, religion, or social status or financial status of a person. They affect each and everyone equally. Coming to the point, when you need to take help of a psychiatrist. First of all, the most common disorders which we come across in any OPD setup are depression, anxiety disorders, and alcohol use disorders all over India. So, depression and anxiety, how do they present? See, only not just feeling sad or getting tensed when you can't reach your goal temporarily. That is not depression. Depression is total feeling of hopelessness and helplessness plus worthlessness. So there is a very huge feeling of guilt which might be minor for someone who is watching you, but it feels very big to the patient. There is a feeling that I have committed some big crime in my past, and that is why I am being punished by God now, punished by God, or punished in this life now. There is hopelessness in the life. Patient sees no hope for the future, and hence such feelings trigger sadness of mood. Uh, Patients don't feel happiness in whatever they used to enjoy earlier, like maybe going out, going to movies, going to shopping, going on a ride or a long drives. People stop enjoying these things, completely cut off from outside world, keep to themselves, do not talk to anyone, and this constant sadness causes sleep problems, uh, reduction in appetite, and concentration. Patients can't concentrate on their work. They have no interest in working, and this triggers eventually suicidal ideation. Some people do try to commit suicide. In fact, the biggest percentage of people who attempt suicide are found to have depression. So depression is one major illness. Uh, I mean, one illness which affects a lot, huge number of population throughout the world. The next group of disorders are anxiety disorders. So the symptoms of anxiety include palpitations, that is fast heartbeats, tremors, uh, feeling of unknown fear, then loss of sleep, many other physical complaints like abdominal discomfort, uh, other physical symptoms like sexual problems, or even increase in micturition, increased frequency of defecation, loss of appetite, mm, disturbed sleep, and patient does not feel, I mean, he has urge to go out, but due to the fear that he cannot go out, due to the fear he cannot start work. There is constant fear of happening something bad, or something bad happening in his life. So these are symptoms of anxiety. Now there are different various types of anxiety disorders. The anxiety, whatever situation it happens in, we name the disorder according to that. So The important ones are generalized anxiety disorder, in which there is anxiety throughout the day, and other common types of anxiety disorder are phobias, phobias of heights, phobias of blood, phobia of needles, phobia of injection and needles, which is most commonly seen all in our nation. Then there is phobia of dogs, phobia of cats, phobia of lizards, phobia of spiders. So all these are phobias in the situation. So phobias are named after the trigger, in which situation the anxiety is triggered. So this is in short about anxiety, the main symptoms of anxiety, main problems which you might experience if you have anxiety disorder is reduced sleep, constant worrying, constant feeling of uneasiness, abdominal discomfort, fast chest beating, tremors in hands and legs, unexplained pains, muscle aches, constant tiredness. So if you have these symptoms, then it can be a symptom of, it can be a part of anxiety disorder. So other major disorders are schizophrenia. Schizophrenia is a psychotic disorder as we call it, and it affects around 1 to 2% of population all over the world. So in schizophrenia, what happens is patient becomes suspicious. So suspicion, that is delusion, is one of the major part of symptomatology of schizophrenia, and other major part is hallucinations. So delusion is fear, suspiciousness of anything and everything. Patients start feeling suspicious that people are against him, people are trying to are talking about him, trying to harm him. Neighbors have fit cameras into my house and they are watching it through those cameras. They have fixed some machine in my brain through which they know my thoughts, and everyone on the street knows my thoughts. They talk about me, they plan against me. My wife is unfaithful. So everyone and anyone who talks to the patient is being seen by uh, suspiciousness by the patient. Mm, so this is a part of schizophrenia known as delusions. In hallucinations, what happens is people start seeing things that don't exist, hear the sounds which don't exist. For example, he hears the voices of 7 to 8 people conversing in his next door house. The people are talking about him, talking ill about him, planning against him. So these are hallucinations. Other common symptoms of schizophrenia are catatonia, or uh, disorganized behavior, in which the behavior of patient cannot be explained. They keep on their self care is lost. They don't take bath for days together, stay at home, don't go out, keep fighting with family members, even to sometimes strike. They get violent. Sometimes might get suicidal. So another important thing is that their self care goes down. That is, they don't take bath for days, weeks together, no shaving. Uh, they wear dirty clothes. They are not bothered about anything about their appearance, etc. Even while going out or talking to others, their interaction to others become less. So this is schizophrenia. So these are about like major psychiatric problems which we commonly encounter in the society. Other problems are like alcohol use disorders and other drugs, illegal drugs like cannabis, which is known as ganja, marijuana, or charas. It is used in form of smoking, quite common in college going students. So other substance use disorders like drugs are illegal painkiller injections, painkiller tablets, even brown sugar and heroin, which come under opioids, whiteners, which is being quite popular among adolescents nowadays, and majority of the remand home population has at least used it a few times, which increases the criminal tendencies in the children, adolescents. So these whiteners, etc. This is one group. Another subset of psychiatric disorders are found in children, which are ADHD, autism. So in which the say suppose children have some symptoms like mm, urinating in the bed at night in sleep, or lying at home frequently, stealing at home, missing school, fear of leaving mother alone. So these types of behavior can be some indicator of psychiatric problems. So these are in short about psychiatric diseases. So in few lines, so loss of sleep, loss of appetite, increased anger, suicidal ideas, loss of interest, excessive fears of anything, excessive fears leading to stopping work and compromising his family duties, his or her family duties, suspiciousness. So if some of your known to people have such any of such symptoms, you can ask them to take help of a psychiatrist. So thank you.